Okay, so we shall start with a new chapter today, that is anti-anxiety drug. Again, it's a part of your drugs acting on the CNS. Okay, coming to the outline of the chapter. Before going into the actual drugs, we shall see the principal types of psychiatric disorders. Okay, so here on the drugs or the chapters which we are going to study are related to the treatment of psychiatric disorders. Okay, so before going into those chapters, we shall see what are the types of psychiatric disorders, or what types they are classified into, and what are the symptoms which are seen in such type of conditions. Okay, for better understanding of the treatment line. Okay, then we shall see what anxiety is in brief, then the classification of drugs which are used for the treatment of anxiety, then the classes, the individual drugs under the classes. That is, first class under this is benzodiazepines, which we have already covered in details. Okay, so here we'll discuss how it is helpful in controlling this condition, anxiety. Okay, then one drug belonging to azapirone class, that is Buspirone, we are going to study in detail. Then hydroxyzine, okay, it is an H1 antihistaminic agent, and the last class, that is beta blockers. Alright, now before going into the actual drugs used for the anti-anxiety, now we shall see what are the different types of psychiatric disorders and what are the different types of treatments which can be given, what are the different types of drugs which are known to be effective in controlling this psychiatric disorders. Okay, so now this term is introduced for the drugs which are used in condition called as mental illness. Okay, so these are the drugs which are used in the mental illness. Okay, so your mental processes are affected in this particular condition or these various disorders. So a group of drugs which are used to treat these conditions, okay, mental illness, these are collectively known as psychopharmacological agents or psychotropic drugs. So what is the definition of this now? So these psychopharmacological agents or psychotropic drugs, these are those which have primary effects on psyche. Okay, now psyche means mental processes, okay, which is mainly affected in the psychiatric disorder. So these agents will affect your psyche or the mental processes, your normal processes, okay, which has altered in this psychiatric disorder. So these are the drugs which are useful in the treatment of these psychiatric disorders. Alright, so now you all must have heard the term, these generally people say that he was a psychic and all such terms are used commonly. Okay, so that means there is some problem with the mental functioning, okay, that the person is suffering from some kind of psychiatric disorders. Okay, so it's not just one term, but there are a number of conditions which are involved in this psychiatric disorders. We will also see the actual classification in what individual disorder, what exactly is happening or what exactly is getting affected, okay, in your brain. Okay, so what kind of function is getting affected, so that also we are going to see in detail. Okay, now if you can consider the diagnosis of these psychiatric disorders, this is generally imprecise and there is quite a lot of overlapping. Okay, that is there are no symptoms like which will have a clear cut demarcation between the two conditions. Okay, more than one condition, the same kind of symptoms may be seen in more than one type of psychiatric disorder. So these symptoms are quite overlapping, so it does not give a very clear cut ideas. But recently, yes, there have been lot of studies done in under mental illness, and there are identification of predominant manifestations in a particular condition, so that it will have a guidance for the use of specific type of drugs. You cannot say that a particular drug is used for more than one type of condition. Nowadays there are classified agents which are specifically used to treat a particular condition. Say for example, there are antidepressants which are used specifically to treat the depression. There are anti-manic drugs which are used specifically to treat the mania or bipolar disorder. There are anti-anxiety drugs which specifically help in controlling the anxiety. So nowadays it is very important to categorize these psychological conditions, because these specific treatments are available. Okay, so specific drugs are now available for most of the psychiatric disorders. No doubt one drug may be used for more than one condition, but there has been a specific demarcation, and there are specific kinds of classes of drugs which are available. We will see in detail that also. Okay, so before coming to the principal types of the psychiatric disorders, it is basically divided into three types. Okay, first one is the psychosis, second one is affective disorders, and the third one is neurosis. So these are the three gross types of psychiatric disorders. Under this, again there is sub-classification, various conditions are involved under this also. Coming to the first one, that is psychosis. Okay, so now what do you mean by this condition, psychosis? So these are severe psychiatric illness with serious distortion of the thought. So these are the things which are getting affected over here. Thought, the thinking of the person is affected. Behavior, there may be behavioral changes. Then the capacity to recognize reality and of perception. So there is a problem. So there is a serious distortion in the thinking of the person, in the behavior. You know a particular person for years together. So suddenly if you identify that there is some change in the behavior, okay, which is not normally seen in that person. Okay, so that means there is some kind of behavior changes which is taking place. Apart from that, the capacity to recognize the reality, okay, to think coherently about a particular situation or a thing is lost over here. Okay, and perception, your ability to perceive something, that is to make correct decision. You have that ability to identify what is correct, what is wrong. Okay, so you perceive things correctly from your point of view, but that is majorly affected over here. So there are symptoms like delusions, that is false belief. That means you think that it is in this way, but actually it is not correct. That is delusion, meaning false belief about something. Say for example, I have given you all this example earlier also. Say if you see some people talking amongst themselves, then if you think that they are talking about me, that means you are thinking wrong. They may be talking something else, but you feel no, they are talking about me. That discussion which was going among them, it was about me. Okay, so that is a delusion or a false belief about something. So this is just an example. You may have false belief about several things, several situations in this condition. Then hallucination is an important characteristic feature over here. So hallucination, we have also come across this term many times. Hallucinations meaning hearing or seeing something which is not existing. You may hear sounds, you may hear people talking when actually there is no one around you, when there is no one talking. You may see people around you, you may say a particular person you may see, when actually that person is not existing. Okay, so others will tell you that no, there is no one around. That means you are hallucinating. Okay, so that is a best example of hallucination. Okay, so here there is an inexplicable misperception and misevaluation. That means you are not able to perceive things correctly. Okay, whatever you see or you feel is not correct actually. Okay, and there is misevaluation. You are not able to evaluate things correctly, whether it is correct or whether it is wrong. So it may be affecting certain people so much that they are unable to meet the ordinary demands of the life. Okay, so they are severely getting affected. Now coming to the types of these psychosis. Now there are two types of psychosis. First one is the acute and chronic organic brain syndrome or cognitive disorders. These are collectively known as. Okay, say for example over here delirium and dementia. Dementia we have seen in the earlier lectures when we have considered the cognition enhancers. Okay, so such drugs are used for the dementia. So here in these conditions there is some kind of pathological basis. You know what is the pathological cause behind this. It is well defined. Okay, and the prominent features over here are confusion, the mental confusion or disorientation. You will not be able to perceive the directions or orientation correctly. That is disorientation. Defective memory. The person may not be able to remember things. We have seen that forgetfulness may be seen in this particular condition. Then disorganized behavior. Again here behavior is getting affected due to all these situations. Then coming to the second type of psychosis, that is functional disorders. Okay, now here there is no underlying cause which can be defined. Here there was a pathological basis, right? In case of acute and chronic organic brain syndrome. But in case of functional disorders, there is no underlying cause as such, okay, which is well defined. And here memory and orientation, these are retained. We have seen that in this condition disorientation is seen and there is a defective memory. So these two, orientation and memory, are getting affected. But in case of functional disorders, memory and orientation are not affected, they are maintained. Person will not have any forgetfulness seen, or the person will be well oriented. Okay, but what is affected mainly? Here emotions are mainly affected, thought is mainly affected, the reasoning about a particular thing or a situation or a person is getting affected, and behavior. These things are getting majorly affected over here. Now this functional disorders again can be of two subtypes. Schizophrenia is the one condition which is popularly known as the split mind or split personality. You all must have heard of very in certain movies also this has been shown. Okay, this condition of schizophrenia or split personality as they called is commonly. So there are two types of functional disorders, schizophrenia and paranoid states. Now let's see what is happening in the schizophrenia, or as it is commonly known as a person is having a split mind or a split personality. That means there is a splitting of your perception. Now what is happening over here? The person's perception is splitting, or interpretation about some reality, okay, or a situation is splitting. That is, a person will behave in the person will behave in one manner at a particular time, and the person will behave in a totally different manner in another situation. That is, there will be marked changes in the behavior of that particular person, as if that person has become someone else. You will find marked changes in their behavior and in their perception and interpretation. They will behave totally different. Okay, so as if that mindset is something different. Okay, and here the prominent features are hallucinations. The person will start hallucinating, hear and see someone who is not existing. They may talk about that they are hearing someone speaking, or they can see someone. They will talk about, say, a specific person who is there, and at times this condition may be that severe that the person may that whoever that person is seeing or hearing, that person may start commanding. Okay, that is that particular person who is not at all existing. That actually it's all the mental play. That person is only imagining things. Okay, so as if someone is there along with them, and that person may even command. They will act in the same way like what that person is telling them to do. They will act in that manner. So it can be that severe. Okay, then there is inability to think coherently. The person may not be able to think coherently or appropriately. Okay, so thinking may get, or perception is severely affected in this condition. Then the second type of functional disorder is paranoid states. Okay, so here there is persecutory or other kind of fixed delusions. Okay, so persecutory delusions meaning those which are totally, which is not going into the actual situation. The person will have their own belief. Okay, that is, they will make their mindset about some situation or something or some person. Okay, so they will actually make some false belief in their mind about something or some situation, and they will lose their insight into the abnormality. Okay, Okay, that is, they will not look into a particular thing or a situation correctly. So that is known as a paranoid state. Then coming to the second type. So what we have seen so far is psychosis, which is the first type of psychiatric disorder. The second one is affective disorders. Okay, now here mainly the mood of the person is getting affected. Now again, this can be of two types. One is the mania and the second one is the depression. Mania meaning there is elation or irritable mood. So the person, elation meaning excitement is seen over there. The person may behave, recklessly, and the mood will be irritable. They will be excessively talkative. There may be reduction in the sleep. They will not be able to sleep properly. These people will be hyperactive, and there may be uncontrollable thought and speech seen in such individuals. So at times they may behave recklessly and violently, okay, which is inappropriate totally. Okay, so this condition is known as mania, and opposite to this condition is depression. So herein the mental state is totally depressed. Okay, here we have seen that it is excitement is seen and irritable mood is seen, but here this is characterized by sadness, loss of interest and pleasure. The person will start to remain isolated, will have a feeling of worthlessness, as if I am not important to anyone. So that is a feeling which the person may have. The person may have a guilty feeling about something. Okay, maybe the person is not acting wrong, but still the person may have that feeling of guilt. Okay, then physical and mental slowing may be seen. You will not see those people taking interest in day-to-day life, or maybe some kind of mental activity. They may not be able to carry out that appropriately. Then melancholia. Okay, this is also a severe kind of depressive symptoms which may be seen in a particular person, wherein the person's abilities may get affected. Okay, then self-destructive ideation. This is very important. The suicidal tendencies will come into mind of that person. Self-destructive meaning they will not harm someone else, but here what they will do, they will try to harm themselves. They may try to commit suicide if they are under excessive depression. A lot is being talked about this nowadays, okay, in this pandemic situation. Now these are the two different states of your mind. One is the irritable and excited state of the mind, and in this there is a sadness or depressive state of your mind. Now either of these situations may exist in an individual individually. In a particular person, you may either see the person is suffering from mania, or the person may suffer from depression, depending upon the situations around. Okay, that too plays a very important role. Okay, or the situation may be bipolar. Okay, now bipolar, or they are cyclic mood disorders as they are known as. Okay, bipolar meaning here the person is suffering from both these situations. Manic depressive situation it is known as, meaning for some time the person may suffer from mania, other time the person may suffer from depression. So cyclically the person will suffer from mania as well as depression. So it is known as cyclic bipolar disorder. Okay, so either both the situations may exist in the same person, or it may be unipolar. That is, either the person will suffer from mania, or the person may suffer from depression. Okay, so this is affective disorder. Then the third type is the neurosis. These are a little less serious kind of things. The first two we have seen that quite a lot the behavioral changes also are taking place, but here these are less serious. Okay, but sometimes yes, there may be extreme suffering to that person depending upon the situation. Now again, these neuroses also are of several types. The first one under neurosis is anxiety. Now what is this anxiety? It is an unpleasant emotional state which is associated with uneasiness. The person will not have a very nice feeling. The person will have a feeling of uneasiness. Worry, the person will be worried about something, will have tension about something, or concern about some future. Okay, specifically about some future or about some situation. So that is anxiety. Okay, so normally anxiety is a part and parcel of our life. Every person may be suffering from this anxiety, but treatment is required only when it is severe kind of anxiety. Okay, normally what you have anxiety in a particular situation, it may not require the treatment, or it may be short lasting. So for that you need not, immediately you may not require a treatment over here. Okay, so you need to identify whether the actual anxiety is a chronic one or no, and then you should switch over to the treatments in this situation. And the second type of neurosis is phobic states. Okay, phobia. Okay, phobia meaning fear about something. Okay, so here there is a fear of unknown. Okay, maybe you are afraid of some unknown thing or unknown future perception, or maybe of some specific object or person or a situation. Okay, say for example you may have phobias with the heights, okay, or a particular situation, that is if a stage performance is there, or suppose if you have to give a seminar, if you have to stand in front of 100 people and speak, so you may have a phobia about that. Okay, maybe you are afraid of one particular person. Okay, so that is a phobic state. Then the next type is obsessive compulsive behavior. Okay, so here thought and behavior is become abnormal over here. Okay, so here you have intrusive thoughts or ritual like behavior, meaning here you behave in such a way that you know that it is incorrect. Okay, you realize that whatever you are behaving is abnormal or stupid, but you are not able to overcome that situation. Okay, so you tend to behave in certain situations in a particular way in which you know that it is incorrect. Whatever I am behaving or whatever I am talking is stupid or something very much abnormal, but you are not able to avoid that. Okay, so obsessive compulsive behavior. Okay, so you behave in a particular manner, okay, which you know is incorrect, but you cannot avoid that. Okay, so that is obsessive compulsive behavior. Then the next type is reactive depression. Okay, so earlier we have seen under affective disorders also there is a depression, but this is a different kind of depression. This is a reactive depression, meaning it is depression which is produced due to some kind of physical illness. Okay, maybe you are suffering from some kind of chronic disorder, so physical illness may be responsible. So you are that depression is because of some other situation or some kind of illness, say some physical illness or loss or blow to the self-esteem, if your self-esteem has got affected. Okay, so if somebody talks something bad about you, okay, so your self-esteem will get affected, so you may feel a little bit depressed. Okay, then bereavement, that is isolation. If someone is not taking you into their groups, they are trying to avoid you, they are keeping you isolated. Okay, so at that time also you may show depressive symptoms. So that is reactive to a particular situation. Okay, so such kind of depression towards a particular situation or a illness, if it is excessive and disproportionate, then you can say that it is a reactive depression. Okay, normally if somebody says and somebody talks about you and you feel bad, okay, that doesn't mean that you are into depression. Okay, so you should need to perceive or identify what this condition is. So whenever it is excessive or disproportionate, then it is called as reactive depression. Okay, the next is post-traumatic stress disorder. So this is actually after you have experienced some distressful kind of conditions, like say if you have experienced a war, if there is a war going around, riots, okay, some fights are going around, or earthquakes, if you experience that, you are afraid, right? You feel traumatic or you feel stressed after that situation. Okay, when you have experienced such kind of situation. So these kind of symptoms which are produced, or stressful state of your mind after all these conditions, is termed as post-traumatic stress disorder. And the last one under this is hysterical. Okay, hysterical meaning dramatic symptoms, meaning actually you are not suffering from any kind of pathophysiological condition. There is no pathology, you are not suffering from any kind of disease or disorder, still you start producing some kind of symptoms which are situational. Okay, so these dramatic symptoms will resemble some kind of serious physical illness, when actually you are not suffering from any physical illness, still you start producing those symptoms, and these are situational, meaning you will show those symptoms only in presence of some people maybe. Okay, so it is not seen otherwise. You are not suffering from any kind of illness, but these symptoms appear only situationally. It's not that the person it does not faint, meaning they are not acting like they are getting the symptoms. Actually, symptoms are being produced in that particular person, but the basis for those symptoms are psychic and not physical. You are not suffering from any kind of physical disorder because of which the symptoms are produced, but it's all psychological, and it is shown only in certain situation or in presence of certain people. Okay, so that is the meaning of hysterical. Now, various studies have been carried out to identify the pathophysiological changes, and studies have put forth that dopaminergic overactivity, your dopaminergic system in your brain may be overactive in the limbic system in these two situations, schizophrenia and mania. Okay, so you need to control this. Okay, dopaminergic overactivity. Whereas in case of depression, monoaminergic deficit, that is decrease in the transmission of noradrenaline and 5-HT, that is 5-hydroxytryptamine or serotonin, may be seen or is the underlying cause for the depression. So accordingly, treatments have come forward. Okay, so there are several drugs which are discovered specifically for a particular type of psychiatric disorder. Though the treatment is empirical, that is depending upon your experience, you may have to talk to that person, what exactly that person is feeling, or you need to diagnose properly. Okay, and over a period of time, you may, out of the experience, you may select the best possible drug to that symptom, that particular person. Symptom oriented treatment these are, meaning they will specifically control the symptoms which are produced in these conditions. So based on this, there are several drugs or several classes of drugs have come forward, okay, for treatment of certain conditions like antipsychotics. Okay, these each chapter you are going to study in detail now here onwards. Okay, so antipsychotics, these are also known as neuroleptics. Ataraxics is another term given to them, or major tranquilizers. So these are useful in all types of functional psychosis. Schizophrenia is the main one in which these drugs are useful for the treatment of, that is split personality. Then anti-manic or mood stabilizers, obviously as the name implies, it may be used to control the mania or to break the cyclic disorder, cyclic bipolar disorder. Okay, then antidepressants. So these are drugs which are used for minor depressive situations or major depressive illness. Then phobic states, phobias can also be treated by antidepressants. Obsessive compulsive behavior and certain kind of anxiety disorders, antidepressants may be used for. Okay, and these two classes, antidepressants and anti-manics, together are referred for drugs which are used for affective disorders, because we have seen affective disorders meaning mania and depression. So collectively these two classes, these two are separate chapters which you are going to study. So collectively these two are known as drugs for affective disorders. Then the next type of treatment is anti-anxiety. These are also known as anxiolytic sedative or minor tranquilizers. Antipsychotics are known as major tranquilizers. These are known as minor tranquilizers. These are used for anxiety and phobic states. And next type of drugs are psychotomimetic. These are also known as psychedelic, psychodyspeptic or hallucinogens. Okay, so as the name implies, these are the drugs. We have also seen ketamine, if you can remember. Okay, so it's an hallucinogen. Okay, so these are the drugs which are actually precipitating the condition. Psychosis like states may be produced in a normal individual when these drugs are given to a particular person. Most of the drugs categorized under this chapter, these are of abuse liability. These are consumed by people just to derive the pleasure out of them. Cannabis is the best example over there. There are many. Most of the drugs have abuse liability. The person may become dependent because euphoria may be derived from them. Okay, so these do not have any therapeutic usage. They are not used therapeutically, but they have abuse liability. Okay, then these tranquilizers, we have seen the term major tranquilizer and minor tranquilizers. So tranquilizer meaning a drug which reduce the mental tension and produce the calmness without inducing the sleep. They don't induce the sleep or They do not depress the mental faculties, okay, but here they relieve the tension and produce the calmness in that person. Okay, so that's how the term is given to this. Okay, anti-anxiety, meaning to calm down the particular person. Okay, so now this is to do with the psychiatric disorders and the various treatment lines which can be given. Okay, so out of these we are going to start with the first chapter, that is anti-anxiety drugs. Okay, now anxiety we have already seen in our introduction. It is an emotional state, unpleasant in nature, which is associated with uneasiness, discomfort, concern or fear about some defined or undefined future threat. This is a definition for anxiety. Now normally, as we have seen, that anxiety is a part and parcel of our life. Every one of us have experienced some degree of anxiety in our life at certain situations. Okay, so it is normal to suffer from anxiety, okay, in a particular situation, but if it is disproportionately high, excessive in a particular situation or particular thing or about a particular person or future concern, that means there is a need for some kind of treatment. Apart from this, anxiety may also be associated with some kind of pathological situations like cardiac neurosis is there, GI neurosis, social anxiety, obsessive compulsive disorder, post-traumatic stress disorder, okay, and various forms of phobias. These are also type of anxiety. Now coming to the treatment of anxiety, anti-anxiety drug. Now what is the definition of anti-anxiety drugs? Okay, so these are the ill-defined group of drugs, mostly mild CNS depression. So they will produce CNS depression, but it is a mild kind of CNS depressants which are aimed to control the symptoms of anxiety, okay, and to produce a restful state. Here the person's emotions are getting affected, the person may feel uneasy or restlessness may be produced, so they produce a restful state of mind without interfering the normal mental or physical functions of that person. Okay, so now these some properties have been discussed over here of these anti-anxiety drugs. They have no therapeutic effect to control thought disorder of schizophrenia. Okay, so they are not effective in schizophrenia. They cannot be used to treat schizophrenia. They do not produce extrapyramidal side effects. So these are extrapyramidal side effects are specifically shown by antipsychotics which are used in the treatment of schizophrenia. So such kind of extrapyramidal side effects are not produced by these drugs. They have anticonvulsant property. These anti-anxiety drugs, okay, like BZDs, they have anticonvulsant property, we have seen. Okay, then produce physical dependence and carry abuse liability. Okay, though BZDs have low abuse liability, still physical dependence may be seen upon prolonged use. So they are the drug of abuse liability. Then they do not selectively block the conditioned avoidance response in the animal. Now what is this conditioned avoidance response in the animals? Like supposing if you put an animal in a cage which is having a grid, okay, and this is part of some psychological experimentation also which is done in the animals. Okay, so there is a grid onto which you leave the animal and there is a pole, okay, onto which the animal can climb. Now what is done in this is just an example. What you do is if you apply the shock to that grid, okay, what will happen? The animal will try to jump and escape from that situation, from that particular situation of shock. Okay, mild shocks may be given to that grid. Okay, but what is done is in this experimentation the animal is trained in such a way, like say for example you give a signal to that animal before giving the shock. Repeatedly it is done every day. Like say for example maybe you will give a buzzer sound and then give the shock. Okay, so initially the animal will not come to know, but later on as you do this repeatedly every day, the animal will come to know that after that buzzer sound is ringing, after that the shock will be given. So that animal will get used to that. So at times when you give the buzzer sound, immediately the animal will go and climb onto that pole. Okay, so this is the conditioned avoidance response which may be produced. It is conditional. Certain condition is put to that animal and the animal identifies that condition and reacts accordingly. So this is a condition avoidance response. So this is not blocked by these anti-anxiety drugs. Okay, then coming to the actual drugs, classification of the actual drugs which are used as anti-anxiety drugs. The first one is the benzodiazepines, which we have already covered in detail in sedative hypnotic chapter. Under that also we have seen that certain drugs have specific action. Okay, certain drugs have specific sedative property, certain have anticonvulsant property, certain have specific anti-anxiety property. Over there it was their subclass of benzodiazepine, anti-anxiety. Okay, so over there we have seen these 5 drugs: diazepam, chlordiazepoxide, oxazepam, lorazepam and alprazolam. So these BZDs specifically have anti-anxiety action. So act specifically in certain areas of the brain so that they have anti-anxiety property. Next class is azapirones. Over here there are 3 examples: buspirone, japirone and ipsapirone is the example. Then the third class is sedative antihistaminic. These are antihistaminics. These will block the histamine receptor actually. Histamine is an autocoid. So they can block the histaminic receptor. So that's how they are called as antihistaminic, and they have sedative property also. There is only one example where there are actually many antihistaminics, but only one which can be effectively controlling your anxiety. Example is hydroxyzine, and the fourth class is beta blocker. Okay, propranolol is the only one which can be used in anxiety. Okay, and apart from this, okay, apart from these 4 classes which we have seen, there are certain antidepressant class drugs which are also effective in controlling in certain types of anxiety situations. Classes like SSRIs, that is selective serotonin reuptake inhibitors, SSRIs, or SNRIs. These two are antidepressant classes, or serotonin and noradrenaline reuptake inhibitors is SNRIs. So these 2 classes of drugs are actually used as antidepressants. These are also effective in obsessive compulsive disorder, phobias, panic and many types of generalized anxiety disorder. These can also be utilized. We have seen under the treatment also previously that it can be used to control certain phobic situation or anxiety situation. Coming to the first class, that is benzodiazepines. We have already covered this in detail under the sedative hypnotic chapter. Okay, so here you will not be dealt with in detail the pharmacology of these agents, because we have already covered this. You can refer back to that lecture. Okay, so benzodiazepines, now how they are helpful over here, certain points will be repeated maybe. Okay, so these some members, okay, not all the benzodiazepines, but only those 5 agents which we have seen that specifically have anti-anxiety property. So few of these, they have a slow and prolonged action. Okay, and rather these will relieve the anxiety at lower doses without producing global CNS depression. Okay, we have seen that they have CNS depressing property, but here specifically in lower doses they can be used to control this condition rather than producing global CNS depressant action. Okay, in contrast to barbiturates, we have seen major difference between these benzodiazepines in barbiturates. So in contrast to these barbiturates, they have more selective action towards this limbic system. Okay, so these have a better control over this anxiety as compared to barbiturates. We have seen that they are no longer used for these situations. Okay, and apart from that, in anti-anxiety doses of these benzodiazepines, we have also seen that in therapeutic doses they least affect the other systems of the body. So cardiovascular depression or respiratory depression, which is shown by barbiturates, actually it is not seen with the benzodiazepine, or effects, if at all they are shown, these are not very much significant. Okay, now so this anxiety is quite a common complaint. Okay, so many of the people may be suffering from this anxiety. Okay, and it is, we have seen that it is a part of physical or mental illness also. Okay, so you will see that anxiety will accompany some other physical situation or a mental illness. And another advantage is that benzodiazepines have a little effect on other body systems. There are certain advantages with this drug. They have little effect on the other systems of the body, low abuse liability, and these are relatively safe. We have seen therapeutic index is high. So because anxiety is a common cause, okay, it is a common cause, it may be associated with other conditions, and we have seen that BZDs have quite many advantages. Okay, so presently BZDs are the drug which are most widely used. Okay, it is a class of drug which is most widely used, and there are many uses of benzodiazepine. So we are seeing that they are having many other uses also. So it's quite a useful class nowadays. Mechanism of action of BZDs we have already covered under sedative hypnotic chapter. We have seen that it has GABA facilitatory action. That is, they will promote GABA binding to its receptor, and opening of the chloride channel will take place. Chloride ions will flow through, and that's how the inhibitory action will be seen. Then at higher doses, now this is what is happening at normal doses. At higher doses, it can induce sleep very well. Okay, so it can have hypnotic property, it can impair the performance of the person, the skillful performance may get affected. There are several side effects also which may be seen. Okay, so these include sedation. Okay, we do not want sedative action over here. Over here we want the anti-anxiety action. So sedative property becomes a side effect over here. Okay, lightheadedness may be seen. Psychomotor impairment may be seen. The person may not be able to perform some kind of skillful operations like machine operations or driving. Cognitive impairment may take place. Cognition of the person, perception may get affected. Vertigo may be precipitated. That is, it will appear as if things around or things around you are going round and round. You will feel have a giddy feeling. That is vertigo. Then a slightly confusional state may be seen. Increased appetite. Okay, you will feel more hungry, and that's how weight gain may be seen. Alteration in the sexual functions may also be seen. Okay, rashes are uncommon. This is not a common side effect, but rarely rashes may also be seen. If you can consider adverse effects in the women, they may fail to ovulate. Ovulation may not take place if they are consuming BZDs regularly. And the major problem with the long-term use of these drugs is production of the dependence. Though abuse liability or dependence tendency is low with BZD, still there are chances that the person may become dependent if you use the drug chronically. If you can consider the individual drugs, the differences are only the pharmacokinetic, the main properties remain the same. So choice of one drug over the other is largely empirical, that is depending upon the experience and the situation of that person and the symptoms which is seen. So you can choose among the drugs which is best suitable for that particular person out of these: diazepam, chlordiazepoxide, oxazepam, lorazepam and alprazolam. They only differ in their kinetic properties. That's what we have also seen under the sedative hypnotic chapter in detail. Then coming to the next class, that is azapirone. Okay, buspirone is the example. So it is the first example under this class, azapirone. Okay, which was introduced for this condition of treatment of anxiety. Okay, so buspirone. What are the properties of this buspirone? So it does not produce any significant sedation or cognitive function impairment like what BZDs do. Then it do not interact with BZD receptor, or it modifies the GABAergic transmission. So mechanism of action is different. It does not bind with this receptor. Then it does not produce any kind of tolerance of physical dependence like what we have seen with the BZDs. Okay. Then they do not suppress the BZD or barbiturate withdrawal symptom. Like supposing if you are taking BZD or barbiturate over a long period of time, and if you suddenly stop the treatment, withdrawal symptoms may be precipitated. So buspirone, if you continue the treatment with buspirone, it will not suppress these withdrawal symptoms. Okay. Then has no muscle relaxant or anticonvulsant property like what BZDs are having. Such muscle relaxant or anticonvulsant effects are not shown by buspirone. Now coming to the mechanism of action, how it is having this anti-anxiolytic action. It's not clear, but several theories have been put forth. Okay, so it is thought that it is acting as a partial agonist at this 5-HT1A receptor. 5-HT1A receptors are the serotonergic receptor. 5-HT is a serotonin. It is a transmitter in your brain. Okay, so this 5-HT receptors, okay, these are partially stimulated by this drug Buspirone. Okay, so they have partial agonistic action on 5-HT1A receptor. So by stimulating this presynaptic, before the synapse in that neuron, okay, so by stimulating this presynaptic 5-HT1A autoreceptors, these are reducing. Autoreceptor meaning something, so these receptors are having action on the same system. These are serotonergic receptors, so they are controlling their own functions, maybe release or stimulation of the neuron. So by stimulating this 5-HT1A receptors, it is reducing the activity of dorsal raphe serotonergic neurons. So these are actually serotonergic neurons. So what they are doing? They are actually reducing their own activity. Okay, they are reducing the activity of these serotonergic neurons which are found in this nucleus, dorsal raphe nucleus, which is found in your forebrain. Okay, so it is depressed because of the stimulation of these autoreceptors. Then another mechanism is they can also act as antagonist at certain post-synaptic 5-HT1A receptor. Here these were presynaptic receptors, autoreceptors which were stimulated, because of which the activity of serotonergic neurons was reduced. But when they act on post-synaptic 5-HT1A receptors, they produce an antagonistic action. So ultimately what will happen? The effects of 5-HT will be reduced. Okay, so here the neurons are suppressed and here the receptors are blocked. Okay, so that 5-HT will not be able to bind to this receptor and produce the action. Okay, apart from that, chronic use of Buspirone, it may result in adaptive reduction in cortical 5-HT2 receptor. So 5-HT2 subtype of receptor, there are several types of subtypes. So 5-HT2 subtype of cortical receptor, they will show adaptive reduction. There will be reduction in the number of receptors. Okay. Then apart from that, facilitation of certain central noradrenergic system, meaning your adrenergic system, your sympathomimetic system. So that is facilitated. Okay. So because of this, a mild mood elevating action may be seen. Then Buspirone also has a weak dopamine D2 blocking action. Dopamine receptors subtype D2, this may also be blocked. But though it is blocking this receptor, it does not have antipsychotic or extrapyramidal side effects. Actually, these antipsychotics act by blocking the dopaminergic receptor. Now, Buspirone is also blocking D2 receptor, but they do not have any antipsychotic or extrapyramidal side effect precipitating tendencies. So these are the mechanism of actions. Coming to the kinetics, Buspirone is rapidly absorbed, okay, but it undergoes extensive first pass metabolism. That is, though it is absorbed, it will go to the liver and it will get metabolized. So extensive metabolism will take place, so that bioavailability is less than 5%. So whatever is absorbed, 95% of it will get metabolized before it reaches your systemic circulation. Okay, so it directly goes to the liver, it will get metabolized. Okay, so oral bioavailability is not very good. Okay, and one of the metabolite which is generated, it is active, however, and excretion mainly takes place in the liver and the feces. Both the ways the drug can be excreted, and the T half-life, if you can see, it's very short, 2 to 3.5 hours is the T half-life. So drug is metabolized at a faster rate, or it is removed at a faster rate. So coming to the uses, it can be used to treat the mild to moderate anxiety. Okay, whereas severe conditions, okay, showing panic reaction or obsessive compulsive disorder, it is not effective in. Only mild kind of anxiety will be controlled effectively, and that too therapeutic effect develops slowly. That is, there may be a delay of 2 weeks for it to show the maximum therapeutic effect under the treatment of anxiety. Coming to the side effects, these are also mild. Side effects include dizziness, nausea, vomiting like sensation will be seen, headache, lightheadedness, and rarely excitement may be produced. Apart from that, rise in BP may be seen, specifically in those MAO inhibitors are given So there may be rise in BP. Potentiation of CNS depressant does not take place. Even if you give it along with CNS depressant, there is no interaction which is seen. Okay, then apart from that, mental alertness is maintained. But though psychomotor functions are not getting affected, still you should not allow the person on these drugs to operate machineries or driving. Okay, so to avoid any kind of accidents, it's better to avoid these drugs in this situation. Coming to the next class, that is hydroxyzine. As I told you earlier, it is a H1 antihistaminic drug. It is a histamine receptor blocker. H1 subtype of histaminic receptors can be blocked by this drug hydroxyzine, and it has additional sedative property, anti-emetic property, that is it can control the vomiting, anti-muscarinic property, that is it can block the muscarinic receptor, cholinergic receptor, and it also have spasmolytic properties. Spasm is the involuntary sudden contraction, a spasm of your muscles. So it is a spasmolytic, meaning it can abolish the spasm. Okay, so it is claimed to have selective anxiolytic action. Okay, though it is having so many other properties, okay, it has selective anti-anxiety property also, but there may be accompanying sedation. It is quite marked. So that's a disadvantage. You will be sedated. Okay, so mental depression is seen over here. Okay, so it is used in reactive kind of anxiety. Reactive anxiety we have seen to a particular situation, or that which is associated with marked autonomic symptoms. If there are some kind of marked autonomic symptoms relating to stimulation of your autonomic system, autonomic nervous system, so there this hydroxyzine can be helpful. Okay, and apart from being used as anti-anxiety, it can be used in this condition, pruritus and urticaria. Okay, because it is having antihistaminic property and sedative property. So histamine is one of the major mediator in precipitation of this hypersensitivity reaction. So it can be used for hypersensitivity, treatment of hypersensitivity conditions also. Then the last class is beta blockers. Okay, so beta blockers also we have studied in detail earlier. Out of this, I think propranolol, okay, or other non-selective beta blockers. These help in controlling this symptoms which are produced in this anxiety person. Okay, like say for example, anxiety is accompanied with palpitation. Okay, I have told you what palpitation is. When there is rise in the heart rate, if you just put your hand on the chest, you will feel that your heart is beating very fast. So that is palpitation. Rise in BP can be seen in anxiety. The shaking, tremors. Okay, your body may not be able to remain stable. Then gastric hurrying. So all such symptoms may be seen along with anxiety, because of which the anxiety will be reinforced. Okay, so it will become more severe because of these symptoms. So how these beta blockers will help? Propranolol and other non-selective drugs. So these will help by cutting the vicious cycle. Okay, so by controlling these symptoms, they will help in symptomatic relief in anxiety. Basic underlying cause or the basic psychological symptoms are not controlled, like worry or tension or fear. Okay, so these are not affected by beta blockers. Only thing is they will help in controlling all these symptoms. Okay, so such use of these drugs may be for examination fear or unaccustomed public appearance. So sudden public appearance, if you want to stand in front of people and talk. So such kind of anxiety situations wherein the symptoms may be controlled, and it may help to control the anxiety. So such kind of performance or situational anxiety can be treated with beta blockers, or beta blockers can also be used as an adjuvant drug to BZDs. Along with BZDs, they can be utilized to control the symptoms of anxiety basically. Okay, so this finishes the chapter. Coming to the important questions under this, either definition of anti-anxiety or the classification of the anti-anxiety drugs, or a note on anti-anxiety drugs may also be asked, wherein you have to discuss the entire chapter. Okay, so